Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, I'm going to be answering the question, what type of professional actually sells hearing aids? Coming up. If you or someone close to you suspects that you have a hearing loss, step number one in getting some answers is by having a hearing evaluation completed. You may try to look for the closest hearing practice to your home, try to find an in-network provider, ask your GP for some recommendations, or simply pick the clinic with the best reviews. But you still might be left wondering, what type of professional actually sells hearing aids? Well, upon arriving for your appointment, you are likely to be met by one of two individuals that can both dispense hearing aids, an audiologist or a hearing instrument specialist. And this may leave you questioning, well, what's the difference between the two? And that's why today I'm going to be telling you the four main differences between an audiologist and a hearing instrument specialist so that you can make the best decision when it comes to your hearing healthcare. But before we do that, if you could please give this video a thumbs up, it really helps our channel in bringing videos like these to a wider audience. And while you're at it, go ahead and hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, both audiologists and hearing instrument specialists can dispense hearing aids, but there are some major differences between the two. The first difference between an audiologist and a hearing instrument specialist is their title. An audiologist will only be known by one of two titles, either an audiologist or a doctor of audiology. A hearing instrument specialist may be referred to as such, or might also go by a hearing aid dispenser or an audio prosthetist. The second difference between an audiologist and a hearing instrument specialist is the level of required education. Audiologists before 2007 were required to obtain a bachelor's degree and a master's degree in audiology designated by the title MA. After 2007, becoming an audiologist required both a bachelor's degree as well as a 4-year professional doctoral degree in addition to the bachelor's degree designated by the title AUD. Both MAs and AUDs are considered audiologists. The required level of education to become a hearing instrument specialist is a high school diploma or a GED. The third difference between an audiologist and a hearing instrument specialist is their degree of training and certification. An audiologist completes several clinical rotations in a wide variety of settings throughout the first 3 years of their doctoral program. The final year of their doctoral program requires completing a 1-year externship that's pretty similar to completing residency in medical school. Obtaining a doctoral degree in audiology is dependent on receiving passing grades throughout the program, as well as passing a nationwide standardized examination called the Praxis. Training for hearing instrument specialists varies from state to state, but typically requires the completion of some training program, anywhere in the realm of 6 months to 2 years. Most of these training programs consist of classroom or online education, as well as a variety of hands-on clinical experience under the direct supervision of another licensed hearing care professional. Depending on the state, they may be required to pass both written and practical exams at the end of their program to become a hearing instrument specialist. Both audiologists and hearing instrument specialists must then pass a background check and obtain a license from their own respective state board. The fourth difference between an audiologist and a hearing instrument specialist is their scope of practice. Audiologists are considered hearing and balance experts. As such, they can diagnose a variety of conditions in both children and adults, such as hearing loss, sound sensitivity disorders such as tinnitus, hyperacusis, and misophonia, auditory processing disorder, and balance disorders. Audiologists can select, fit, program, and maintain a variety of hearing aids, such as standard hearing aids, bone-anchored hearing aids, and even cochlear implants. They can administer treatment programs for oral rehabilitation, tinnitus management, improved auditory processing, and even audio-verbal therapy. Audiologists can also treat some forms of balance disorders and will refer treatment for other balance disorders to ENT physicians or physical therapists. Audiologists can also remove earwax and take ear mold impressions for custom products like hearing aid ear molds and hearing protection. They are authorized to work with infants, children, adults, the elderly, and patients with special needs. Now, the scope of practice for hearing instrument specialists does vary state by state. However, their scope generally includes administering and interpreting hearing tests, as well as selecting, fitting, programming, and maintaining standard hearing aids. In select states, they can also take ear mold impressions for custom products and remove earwax. Hearing instrument specialists can only work with adults without special needs and cannot diagnose or treat auditory processing disorder or sound sensitivity disorders like tinnitus. In some states, they can complete balance testing, but cannot administer treatment. Now that you know which professionals can dispense hearing aids, you may be wondering which hearing healthcare provider is right for me. And my answer to that question is going to be the provider that's committed to following comprehensive best practices. Now, if you're unfamiliar with best practices, you can check out my deep dive video that will be linked down in the description below. The main takeaway is that comprehensive best practices consist of a variety of tests and measurements throughout the entire process, from the initial evaluation to the hearing aid selection, fitting, follow-up, and outcomes. Best practices take a significant amount of time, energy, and expertise to complete fully and at the highest possible level. But following best practices is the only way to ensure that every possible effort has been made to have you hearing your very best. Without comprehensive best practices, you run the risk of having many elements of your treatment fall short. This could be like ending up in a hearing aid that doesn't actually meet your needs, ending up in a device that's not actually capable of providing the amount of amplification that you need for your level of hearing loss, or being fit with a hearing aid that wasn't even mechanically functioning to begin with. Although research has proven that best practices result in the highest possible outcomes for patients, unfortunately, fewer than 30% of hearing healthcare professionals actually follow them. That means that the large majority of patients who wear hearing aids out in the world haven't actually received comprehensive care. And as you can imagine, this can definitely impact your satisfaction with your hearing treatment. Both audiologists and hearing instrument specialists do have the training to complete and follow comprehensive best practices. It's just whether or not they choose to actually follow them, and this is going to vary from provider to provider. For this reason, it is critical to find a provider who will commit the time and energy to complete these tests and these measurements to ensure that you can hear your very best. For a list of all of the best practice procedures, you can head over to hearingup.com, where you can have a PDF copy emailed directly to you so you can track when certain measures have been completed during your hearing treatment journey. But if you want to take the guesswork out of it and work with a provider committed to following comprehensive best practices without you even asking, you can head over to the provider locator and enter your zip code to see providers who have been personally vetted in your area.